Hi, my name is Greg Fell, I'm Director of Public Health. This is a situation report on epidemiology of today, the 14th of June. So the numbers are starting to go back up again. Last week we were flatlining around mid-20s per 100,000. Now it's early 30s per 100,000, and I suspect that will be going back up. You can see what's happening in the northwest and certain parts of West Yorkshire. It's inevitable that that will come and affect us. It's almost all the Delta variant, or the variant that first emerged in India. It is more transmissible, there's no two ways about that, than the Alpha or the variant that emerged in Kent. Questionable whether or not it's any more harmful, though there are some signs that might be the case. So thus it's important that we still do all we can to limit the spread of the virus. The Prime Minister will be making an announcement this evening, I think, on step 4 of the roadmap. Purely epidemiologically, I wouldn't be surprised if the Prime Minister announced a short delay to step 4 of the roadmap. The purpose of that delay will be to vaccinate as many adults as possible, because we still remain committed to vaccinating pretty much the whole of the adult population, and we're not there yet. Vaccination programme is going well, so all up as of today, 326,000 adults have had their first dose, 224,000 are fully vaccinated, i.e. had doses 1 and 2. We're doing pop-up clinics and pop-up walk-in vaccination slots all over Sheffield. Last weekend there were some in the city centre, and about 1,500 people turned up to get vaccinated, lots and lots of younger adults, and I'm really pleased that the demand is really there. So it's really important that we continue to do all we can to limit spread. Those most likely to be in the case mix at the moment are people between aged about 16 and 30. They're the least well vaccinated of us. So looking to the future, whenever step 4 of the roadmap happens, and it will happen, numbers will go up, and we then get into the difficult space of balancing case rate versus harm measured by hospitalisation, though it's fair to say that many people will develop long COVID, so we do want to avoid that, and then limiting the social and economic harm that come from blunt measures to control transmission. But case rates will definitely go up, mainly in younger adults and children who aren't going to be vaccinated in appreciable numbers in the immediate future, though we're pushing pretty hard on that at the moment. The current strategy has served us well, despite the fact that we've ridden over 3 waves now. The current strategy probably won't change that much. Summer, in one respect, will be regaining our freedom, but also keeping a lid on case numbers and outbreaks, which will be, as I say, a difficult balance. The key risks remain, to me, variants and mutations. Imagine the scenario where we get a mutated virus that the vaccine doesn't work as well in. We all want to avoid that. Long COVID, the Office of National Statistics data on long COVID is really very sobering, and maintaining high vaccination coverage. This won't be over anytime soon. It's important I'm clear on that. If you want zero COVID, go to Antarctica, because it's about the only place that's going to be truly zero COVID. So what we're trying to get is zero harm and very low rates of COVID. But the things that we'd ask of individuals and businesses and settings to do now has always been pretty constant, actually. If you have symptoms, get a test and isolate. Effective home testing with lateral flow devices is definitely making a difference. That can reduce but not eliminate risk. Get vaccinated, get doubly vaccinated. You must have 2 doses. 1 dose doesn't provide enough protection. Wear face coverings, wash hands, open the windows, get fresh air in, ventilation, keep distance from people, all made a difference, a significant difference. Those kinds of things aren't going to change in the immediate future, and will remain a feature for a while to come.